Thank you all for joining us. This is the PATH CITED How to Make Your Grant Application Stronger webinar part 1. This is part 1 in a 2-part series. I am going to give a quick opening and then we'll go over some of the information that is relevant for CITED and the round 4 application. Everybody see this okay? Okay, great. So what we're going to do today is we're going to have some introductions. We're going to give a really high-level overview of the PATH initiative, talk a little bit about the CITED funding opportunity, discuss eligibility and priorities, talk about how to apply, also give you all an application overview and some tips, as well as talk through some questions, frequently asked questions and next steps. My name is Katie Thomas. I am the CITED Initiative Lead with Public Consulting Group, the third-party administrator that DHCS has partnered with to administer PATH funding. I also have some colleagues here, Shannon Weaver, Oliver Dibb, Allison, and a couple other PCG folks that are on the line. We are also joined by our partners at DHCS in the Managed Care Quality and Monitoring Division. There is Nin, Aisha, Shell, and Lisa, and also Supreet here. So we are joined by quite a few folks. Just to give a little bit of background on PCG and why we are the ones sitting on this webinar. So our responsibilities as the TPA, or the third-party administrator, is to design and review the applications and the funding requests that come in. We also market the opportunity, maintain public-facing documentation, collect and review progress reports. We're also the fiscal administrator of the pass-through agency. We also help troubleshoot issues and provide technical assistance with the application, and we report on best practices and the uses of CITED funding. Some of our goals for today are to understand some of the key scoring considerations. So how will your round 4 application be scored, as well as some strategies and tactics for writing a higher scoring grant application, just giving yourself a little bit more information so you can write to the best of your ability. Going to go over at a really high level just the PATH initiative as a whole. We have already hosted a CITED round 4 informational webinar that is recorded and posted to our website if you want more information and more deep dive on the PATH initiative, as well as the general CITED initiative. So very quickly, PATH is a $1.85 billion investment in building capacity and infrastructure for on-the-ground providers, CBOs, hospitals, other Medi-Cal providers to bolster their ECM, or enhanced care management, and community support services. There is also a justice-involved reentry component, as we are assisting in helping to bring pre-release services to jails and prisons throughout the state. Today, we're going to deep dive a little bit more into CITED. Obviously, that is why we're here, so I won't go too much into this, but CITED has had multiple rounds. It begun in 2023, and this last round of funding opened in 2025, just about 10 days ago. There's been 3 rounds of funding awarded to over 500 organizations for almost $600 million as of August 2024. The last round of funding is now open and closes March 7th. We also have some other program initiatives that you may or may not already be participating in, and we do encourage participation across the initiative. Our Collaborative Planning and Implementation Initiative supports planning and collaborative groups that promote readiness for ECM and community supports. You can register to be a participant. It is ongoing. It is a regional-based collaborative, so you will be placed with others in your region that you can learn from, discuss, and identify some key barriers and strategies for implementation of ECM and community supports. There's also our Technical Assistance Marketplace. You may hear it called TAM or TA Marketplace. It is a free technical assistance shopping experience. So you can go and submit an application to receive technical assistance from a hands-on vendor. There are off-the-shelf projects as well as on-demand that you don't even need to have a login to see. You can go on and see some of those in-demand service or on-demand services available on the website. And then the Justice Involved Capacity Building Project is is funding to support collaborative planning, infrastructure capacity to implement enrollment and suspension processes in order to provide pre-release services to those targeted correctional facilities and community partners. So PATH JI Round 1 and Round 2 are already closed, and Round 3 is open to targeted entities. So if you believe you are eligible to receive PATH JI Round 3, please feel free to reach out and we will direct you to the Round 3 application. And with that, I will turn it over to my colleague, Shannon.
Thank you so much, Katie. So we're going to go into a little bit about the CITED initiative in a quick overview. The CITED initiative provides 4 rounds of funding and is really aimed at expanding capacity and infrastructure for the development and expansion of enhanced care management and community support services. And this is the 4th and final round of CITED funding. Rounds 1 through 3 have all been awarded, and awardees are in the implementation phase at this point in time. With this being the final funding round, the application is currently live. It opened on January 6th, and it will be open through March 7th. It will close at 11:59 p.m. Pacific time. And all applicants who would like to receive and be considered for CITED funding must apply by submitting an application. And that is what we're going to dive into a little bit deeper today. So I do want to highlight some differences with round 4. One key note is that round 4 awardees will be subject to a 1-year award timeline for their projects. So they folks should really be considering what they can implement within that 1-year award period once awards are made. I will say there is no, not necessarily a limit to the amount of funding that can be requested in this round. There is a limit that awardees cannot receive more than $25 million across all CITED rounds. But we did just want to bring this up for folks' awareness and consideration when they're mapping out their budget and their project and the timeline, to really think about how much funding your organization can absorb and be able to fully expend and utilize within the 1-year time frame. So for context, the average amount of funding that has been awarded to applicants in previous rounds, which had 2-year timelines, was about $1.1 million. Go to the next slide. Here we're going to focus on eligibility factors for CITED, and we'll start with talking about the different organization types. There are many organization types that may be eligible for CITED funding, and that includes counties or local government agencies, CBOs, community-based organizations, clinics, tribes and Indian healthcare providers, as well as many others. The key for thinking about eligibility and if your organization is eligible to apply for CITED is really demonstrating that you are meeting those goals of CITED funding, which is to expand enhanced care management and community supports capacity and services, and that your organization is contracted or has a signed attestation letter with a managed care plan, indicating that the plan is intending to contract with your organization to provide those services. And then we do have a tip and a link at the bottom of the screen to our round 4 guidance document. There is a really helpful appendix at the end of this document that lists all of the organization types that you may select in your application that you may identify with, and provides helpful definitions for those as well. You can go to the next slide. So the minimum eligibility criteria, again, is to submit the application. It can't be in draft form. It does need to be submitted fully by the deadline of March 7th, and it needs to include all of the required attachments. We can only make recommendations for funding for things that are allowable. So be sure to review the guidance on the allowability guidelines and things that are unallowable under the grant. We need to see that the applicant is demonstrating a reasonable funding request. We do have some guidance as well on that. And sustainable, how will your organization continue to maintain the services that you're expanding after the award period is over. We also need organizations to be eligible. They need to be in good standing. Applicants need to align with the CalAIM goals as a whole, as well as the PATH cited goals. And then the contracting piece that I touched on the last slide. We do want to emphasize that getting your contracting documentation uploaded, included in your application when it's submitted is very important, or if you're not fully contracted, having a letter that is signed by the MCP that demonstrates they're intending to contract with you, and that process is underway. So additional criteria that the review team is going to be considering when evaluating applications include some of the things that we touch on here. We need to see demonstrated a baseline alignment with the cited objectives. We need, budgets will be evaluated for their clarity as well as the extent to which they provide all of the necessary details. If you're asking for salary, we need to see the FTE, the fringe rate, all of those types of things. We're also evaluating those budgets for reasonableness and sustainability, as I mentioned previously. We're also reviewing to ensure that funding determinations holistically are equitably distributed from a geographic lens across the state. We'll be evaluating how the proposals and the projects are aligned and amplifying the work of other partners and meeting gaps that have been identified in the community. And lastly, we'll be assessing, relative to other approved cited grants, how much will the proposed project expand access to members to receiving those key services with ECM and community supports. And then turning to our priorities, DHCS is considering a number of data sources to inform the funding priorities for this round, which will continue to be aimed, as in previous rounds, at filling gaps in the service provision and capacity, provider capacity. So the priorities include county-specific ECM and community supports gaps. There is variation in uptake and rollout in the services in different counties. And so we'll be looking at places where those gaps may remain for certain services. Statewide gaps include birth equity and the justice-involved populations of focus, which are new. And on the community support side, a statewide gap that will be considered is the new transitional rent community support service. Tribal entities, so tribes and Indian healthcare providers, folks serving tribal members continuing to be a priority in this round, as well as rural counties, counties who have had lower funding in previous cited rounds or lower requests, trying to get that funding out and especially into areas where there may still be gaps, especially rural areas, as well as organizations serving members and individuals whose first language is not English, local CBOs, and counties providing transitional rent. Okay, so a few high-level details on how to apply, and we'll go into kind of some deeper dive information to consider as you're doing so. But to get started, you can reach the application portal by going to our website, ca-path.com/cited. And on that website, there is at the top an announcement and apply now button, which you can click on to access the round 4 application and to access our grant portal. And as a reminder, this is the final round of cited funding. And so if you are considering applying, we strongly encourage you to do so and to access that link early to get your application submitted, before the deadline. Give yourself time to prepare a thoughtful and thorough response. In that vein, some things that your organization can do to prepare to apply before that deadline, acknowledging that the round 4 award period is only going to be 1 year. It's really important that applicants set themselves up to be successful if they are awarded and to hit the ground running, to be able to use all of their funds. So internally, some things that your organization can do is to really take steps to make sure that leaders and other key staff are aware of the project plan, they're bought in, and that resources are going to be available for you to start implementing as soon as you're awarded. Get any leadership or board approval that may be needed for things like new positions, or if you have vendors who are providing services or data systems as part of your proposed budget, make sure that your organization is prepared to act on those asks and those budget items. And then, really be thoughtful as you're putting your budget together and make sure that all of your plans and your proposed budget items are feasible to implement in the 12-month award period once you're approved. Think about how many FTEs you can realistically hire and onboard in 1 year, vendors who are going to be ready to go, and to make sure that you're ready for that implementation phase. And then turning externally, there are some additional things. So making sure that your project aligns with the gaps and needs that are present in your community, collaborating with MCPs, health plans, other key stakeholders, collaborative groups in your region, to make sure that you're aligned with the existing efforts, you're not duplicating efforts, and that you are working towards those gaps and needs collaboratively. Reach out to the MCPs. We'll definitely continue to touch on this a lot. If you're not already contracted, reach out to those MCPs. That can be a slow process. So reach out to them and have conversations to kick that off. And in the interim, getting a signed letter of attestation from the MCP that indicates that they are intending to contract with you, because we will accept that as well. And then getting quotes if there are outside services or vendors that you're going to be working with for parts of your project plan. Make sure that you've gotten those quotes and that they are aligned on your potential timeline. A few tips for the application in the grant portal. So there are a number of required fields. They will all be indicated as such with a red asterisk. The application will not let you submit if you are still missing any required fields. You can save the application and return to it later if you need to gather some more information, but just know that it does need to fully be submitted by the deadline for us to be able to review it and consider it for funding. So be sure that you are filling out those required pieces. Be sure to upload all of your required documentation. So really, really key is that contracting documentation or letter of attestation from the managed care plan, and also the budget template, which is linked later in this slide deck, and is also available on our website, but also helpful to include other supporting documentation as it's relevant to your application. And then last on this front, be sure to confirm all of the relevant contact information. We highly, highly recommend that everybody adds multiple grant managers to your application in the portal. We've definitely seen cases where there may be turnover or a staff member may unexpectedly be out and they're missing key communications or time-sensitive communications from our team. So please be sure that you have multiple points of contact and that somebody at your organization will always be aware if there are updates or attempts to do outreach to your organization. And then one thing that we do want to flag in the application, this is not relevant to all organizations who are applying, but there is a kind of parallel funding process with Cited called IGT, which stands for Intergovernmental Transfer. And the organizations that are eligible for consideration under Cited IGT are cities, counties, local government agencies, and public hospitals. And so only those kind of local government type organizations are eligible. But the way that this works is all applicants are given equal consideration first and foremost for Cited. But then for those organizations who are IGT eligible, those local government organizations, if they are not selected, once they're fully considered for Cited first, then they can be considered for IGT, which is a funding opportunity that requires a 50% match from the awardee. And so we do have a question in the application once you're indicating your organization type. If you've selected any organization types that are eligible for IGT, another question will populate asking you, if you're not selected for Cited, once we've fully considered you for Cited funding, are you interested in being considered for IGT? And so just to reiterate, that does require a 50% match from the awardee. And once those selections are made, if someone is awarded under IGT, they'll have to provide that match. And because this is really a government-to-government funding process, just a note that all contracting and payment processes will take place directly with DHCS. All right, and then I am passing it over to Oliver for the next section.
Well, thank you, Shannon. So the next half of the webinar is really going to focus on some tips, tricks, best approaches for some of the different sections within the application. So today we're going to cover the first 6 sections of the application. These correspond pretty closely with the different headers within the application. So if you've started, you're probably familiar. I do note that the funding request, so the budget section and the last section, the attestations and certifications, will be covered in part 2 of this webinar. That will take place at 10 a.m. Pacific time on February 3rd. So we highly encourage you to register for that on our website like you did for today's webinar. So we're going to start with the first 2 sections, applicant information and about this organization. So this should be one of the simpler parts of the application. It's really general questions about the applicant and the organization applying for funding. So this is going to include things, your contact information, your organization size, and other demographics. It's also where you're going to report your primary and secondary organization types. So I know in the info session, we kind of talked through organization types, but I do kind of a helpful hint. Remember that you're going to select one primary organization type, and then you'll be able to select all that apply for your secondary organization types. So if you are, primarily a, let's say you're primarily a adult healthcare center, you might check that as your primary, but you might also, consider yourself a behavioral health entity or another organization type. You'll be able to select all that apply for your secondary organizations. So the next section of your application is going to be your cited eligibility. Now, Shannon already kind of walked through some of the broad eligibility criteria, some of the supplemental kind of criteria that you'll be reviewed on. But this section of the application really is strongly focused on your contracting status with your MCP. So the application asks you to report on all MCPs that you intend to contract with or are contracted with. And for each MCP that you intend to contract with or are contracted with, for the services you plan on providing with cited funding, you'll be asked to upload your supporting documentation and provide some additional information for that. So the types of documentation that you can upload to show your contracting or intent to contract include a signed ECM and or community supports contract with the MCP. So if you are already contracted for ECM and or community supports, you will upload this contract with your MCP. If you're already contracted as a subcontractor, you can upload a signed ECM and or community supports subcontract with an entity contracted to provide with an MCP to provide ECM and or community supports. So an example of this may be you're contracted with a larger organization to provide ECM or community supports. That larger organization has the direct contract with the MCP. So those are your kind of two if you're already contracted. If you intend to contract, if you're in the process of contracting with an MCP, but you haven't gotten to that, having the signed final contract, you will need to provide one of the following: either an attestation letter that is signed by the MCP specific to ECM and or community supports, or a signed technical assistance or TA marketplace attestation letter from the MCP. You don't have to have both. Either is sufficient. But if you are in the process of contracting, but you do not have a signed contract yet, you do need to provide one of those that is specific to ECM and our community supports and signed by the MCP in order to be eligible. The only thing that is outside of this is tribes, Indian health programs, or urban Indian organizations may provide a MOU or memorandum of understanding in lieu of a contract. So you'll be required to select and upload one of these types of documentation for each MCP you intend to contract or are contracted with, and it must be signed by the MCP and specify specifically ECM and or community supports. If it is just a general Medi-Cal contract for health services, but does not specify anywhere about ECM and or community supports, please note that even if this is signed by the MCP, it is not sufficient for cited eligibility. Right. And so, again, this kind of goes over some more details about what should be within those contracts and or attestation letters. At a minimum, the contract and or attestation letter, again, has to identify ECM and the POF served and or your community supports provided that will be supported with cited funds. So if you are looking to use cited funds to implement ECM for, youth birth equity population of focus, your contract should show that you are contracted to provide the ECM for that POF. It should identify the counties where the services will be offered. So if you are in multiple counties and you're looking to specifically implement a new community support, say in Orange County, the contract or letter that you have should show that specific community support and identify the specific county or counties. It should be signed Contract should be signed by both parties. Have an effective date that shows it is current. So because ECM and Community Supports was approved to begin January 2022, anything earlier, any contracts, letters, addendums earlier than that date are not sufficient as ECM and Community Supports were not implemented before that time. All right. And then just some quick notes on uploading your documentation. So there are upload boxes within Grants Connect. They will, again, please review that previous slide. Make sure you're providing the correct documentation. We often have people upload just the signature page of a contract, and that meets the signature requirements, but oftentimes that doesn't say whether it's ECM and or community support specific. It doesn't list counties. It doesn't provide that additional information. Please rename files so it clearly labels what's in the file. So some examples, PHP ECM contract or Anthem attestation for community supports. This especially helps when you are providing documentation for multiple MCPs and things. It helps us keep track of what is what much easier. If you have more documents to upload than Grants Connect will allow, you can make a zip file with a cover sheet. We have a link here for a wiki how to make that zip file, because we do know file size upload, maximum file size for upload is 10 megabytes. So we really recommend if you have documents that are larger than that to use the zip process. And then just a helpful hint, hopefully everyone has already started to have these conversations, but if you are not already contracted with an MCP in your counties that you wish to serve with cited funds, you should start having these conversations ASAP. So not only do you have to have the signed attestation letter or at minimum before you can, be eligible to be awarded cited, but one of the requirements, if you are awarded, is to have that contract executed by the end of the grant period. So the next section we're going to go over is additional funding considerations. So we really recommend that applications and funding requests consider some different areas of need. So it could be the local MCP needs assessment and gap filling plans, needs identified in local homelessness plans, and needs identified in your PATH collaborative planning and implementation initiative. So those CPI meetings also are great sources for identifying needs in specific areas. We really want applicants to demonstrate and show strategies to avoid duplication and supplementation of other services and funding sources. So examples, IPP, other federal, state, or local funds. And an additional note that cited funds cannot be used for services that are directly paid by Medi-Cal. So one note for this is in the application, if you have been awarded IPP, so Incentive Payment Program funds in the past, been awarded any cited funds in the past, any technical market, PATH TA Marketplace or TAM funds, Whole Person Care Pilot funds, DXF, the Data Exchange Framework Grant Program, you'll be asked to specifically provide info on how much you're awarded and specifics on what type of things you're awarded for. So just noting that if you have received any of those funds before, the application will ask you to expand on those to make sure you're avoiding duplication and supplantation of other services and funding. So we wanted to provide an example of, how would you provide us a narrative that strongly demonstrates how your organization is avoiding duplication of funds. So this is an example for IPP. So you can see that they clearly showed how much funding, so that $58,000, it's a clear dollar amount, and through what source, specifically through IPP, the Incentive Payment Program. They also showed very clearly what that funding was used for. So in this instance, that 58,000 was used to hire an administrative assistant for their ECM program in May 2022. So we know exactly what those IPP funds were used for. And then they also provide us, here's how cited is different. So IPP was used to hire a administrative assistant for ECM, and cited is specifically for our data infrastructure to begin those sources. So when I read that, it's clear what they use the other funds for and how they are totally separate and not duplicative of what they're asking in their cited award. So an additional one is their previous cited funding. So if you have been awarded cited funds in the past, this is a great example. It shows again clearly how much funding was received and through what source. So it shows the dollar amount and very clear what those funds were used to hire those direct staff and managers, pay for admin and leadership time, rent, vehicles, IT infrastructure, and then demonstrates the success of the previous cited funding. So if you've received cited funding in round 1 and you're applying for round 4, round 1 is almost over. We really want to see, has that been successful, and how are you going to use the next round to build upon this, or for what goals? And so this very clearly states how they were successful and what they want to do to continue growth in round 4. The next section is ECM and Community Supports. So here you're going to provide any of the ECM populations of focus and or community supports that are to be provided with cited funding being requested. You're also going to need to provide the number of current and additional ECM and or community supports members that you to be served, and the estimated percentage of funding that will be allocated to each ECM, POF, and or community support. So for this, you should only include populations of focus or community support services that you're going to be using cited funding for. So for example, if you are if you provide day habilitation community support, but you want to use cited funds to implement a new ECM program for those you provide day habilitation to, you would, and all your funds are going to be going to ECM. Even though you provide day habilitation, you would not include that at all in this section of your application. So you would not check day habilitation. You would just check the ECM populations of focus that you intend to provide ECM to with these cited funds. The same goes for the additional members you tend to serve. So if you currently serve, day habilitation, but cited is just for ECM, implementing a new ECM. Currently we provide 0 ECM members, but through working with our MCP, who we're contracted with, we've identified that we would be able to, expand to serving, 50 or however many additional members with the cited funding specifically for ECM. You would not include anything that you are not intending to use cited funds for. The next section is probably, besides the budget, one of the bigger sections that you will be required to fill out in the application, the project description and justification. So the first thing you'll need to do in this section is identify the counties served, an estimated percentage that will be spent in each county with cited funding. Again, just the counties that you are going to use this for. So if you currently provide ECM in 5 counties, but you're requesting cited funds to expand to a 6th new county, the only county you're going to list there is going to be that 6th new one that you plan to use cited funds for. You will also, for this section, it should be clear you are prepared to successfully implement the project within the 1-year funding window. I know it was mentioned earlier that one of the big differences with round 4 is instead of 2 years, it is a 1-year funding window. So we really are going to be looking for your answers to demonstrate that you are ready and able to complete the project within 1 year. With this, you will need to provide a narrative responses for up to 6 questions related to your cited project. And just another helpful hint, your project description should align with the provision of ECM and/or community supports. And it should be clear how your project description connects to your activities requested in your budget. So this next slide is just an overview of this 5 or 6 narrative questions that you'll need to be prepared to respond to in the application. Your project description and goals, your readiness plan to complete the project in 1 year, how your project will help close ECM and/or community supports gaps, program sustainability, post-cited funding, and your history of work in the communities to be served through cited. So for the first narrative question about your project description and goals, you really should be clearly explaining what your goals are, what populations and services you plan to serve with cited funding, what areas you'll serve, and needs and gaps that will be addressed within these communities. So what counties are you, maybe you're not expanding counties, but you're expanding to rural areas within the county you already serve based on identified needs. Excuse me. And lastly, how the requested budget activities align with project goals and goals of the cited initiative. So your goals should always tie back to what you're requesting in your budget. It should be clear how each budget item will help you meet the goals that you've lined out. So here's another example, and I won't, read this all out to you. Again, these will be posted online. But for a strong example of a project description and goals, I pulled out a few specific things. It shows exactly what new ECM POFs and community support services will be provided. It ties specific budget items to the goals, right? So you can clearly see how their, 4 new case managers really tie back to their goals of expanding their ECM program. It shows why the EHR is essential. So why do you need these specific things to reach those goals? And it demonstrates an increased capacity. So if your goal is to expand your current ECM program, it should be clear that those budget items will have a direct impact and measurable impact on that expansion. So that is a really strong example of how to approach your project description and goals. Here's a strong example of an answer to a readiness plan for your 1 year. Again, big change for round 4 is only having a year to implement. So we want it very clear, having clear evidence of your ability to hire staff in 1 year. So if you are planning to hire staff, it should be clear that you are ready to do that. We know that staffing in our, in this area can be difficult. And so making sure that you are prepared, you've identified any barriers and how you plan to overcome them, and that the number of staff is reasonable based on what your organization has done in the past. This example demonstrates multiple planning steps they've already taken, so you can see how they've already prepared. And it addresses any contracting issues. So it addresses those barriers that have been identified. Next narrative question about project sustainability. And here's a really good, strong example of addressing how a project will be sustainable after cited funding. So we really want to see that the new staff you're hiring, the new EHR systems, all of those things that you're planning to request in your budget should be things that you can continue to fund after cited funding is complete in that 1 year. So this example includes specific steps needed for sustainability. You need to provide, you're going to be able to provide services to more beneficiaries, which will generate more revenue. It shows data-driven targets. It shows that you understand and have looked at, how many referrals are you really going to be able to get? How will that, affect caseloads and things and be sustainable? And then demonstrates an active participation with the MCPs to ensure these targets can be met. If you've started your process with contracting or already contracted with an MCP, you know that it's really important that there's clear communication for how many referrals are available and what those pipelines look like to ensure that you can successfully meet those projections that you've identified are needed and necessary to be sustainable. Right. So that goes through some strong examples of the project description and justification section. The next section is the funding request. And so this is going to be what the bulk of our part 2 webinar is about. I know that probably the most significant time spent on completing your grant application will be spent on the funding request and budget, and we will walk through in further detail in part 2 of this. But I want to give you a few reminders and tips as you are starting to prepare. Again, that webinar is going to be on February 3rd, so you have some time in between there to start thinking and reviewing. But in general, your budget activity should clearly align with the narrative. So if your narrative is all about how you want to expand ECM and we're seeing a bunch of budget items for rehabilitation and other community supports, it's going to be really hard for us to understand how, those budget items match your goal. So it's really important that if your goal is to, expand ECM and community supports and you're asking for community supports and ECM budget items, that project description and goals narrative question clearly ties back to both of those goals. You have to submit it with the required template. So on our website, and we're going to have a couple of slides with resources, we have our funding request workbook. The budget has to be uploaded in this worksheet. There are additionally some sample budgets on our website to kind of give you some helpful ideas of how to best complete those. And be detailed and itemized as appropriate. So if somebody who does not know what your project is should be able to read your budget and understand what you're doing. So making sure that you're listing out if you're requesting IT equipment for new staff, that is clear. What does that entail? How many, is that computers? Is that iPads? Is that monitors? What IT equipment? Detail it, itemize it out, how many of each. It should be very clear exactly what you're requesting in those line items. Right. And again, we will be going through this in part 2 of our webinar, but in the meantime, there's detailed guidelines, including allowable use categories, reasonableness guidelines, unallowable uses of funding in our guidance document for round 4. Specifically, pages 10 through 18 really focus on this funding request section. So the link is there. We're going to go through some resources. It's on our website, but highly recommend using the time in between this webinar and the next to really focus on reading through those pages and getting familiar with that work. Right. And now I will pass it back over to Katie.
Thank you, Oliver. Okay, so just a couple of follow-up, wrap-up, next steps for you all, and some really helpful links and reminders. So your next steps are to apply for cited round 4 funding. As Shannon mentioned, that link to the application is on our website, ca-path.com/cited. There's a blue apply button at the very top that will take you to the Grants Connect portal, where you'll be able to create an account if you have not already, or sign back into an account if you've already applied for cited. The round 4 application window, it is open now. It opened January 6th and will close March 7th at 11:59 p.m. So keep that in mind. Please try to submit early, as we cannot guarantee that any questions will be answered that late. We also, if you're having any technical issues that late, we may not be able to get to you at that time. So please do try not to wait up until the very last final deadline. Submit a couple of days early so that we can make sure that your application is fully received and submitted. And then Oliver has mentioned it, but we do have the Part 2 webinar coming up on February 3rd at 10 a.m. There's a registration link. Advanced registration is required. Please make sure that if you have multiple individuals from your organization who are interested in attending this webinar, that they do register individually. We do have registration caps, and we do want to make sure that we're capturing everybody who attends. So please do not share your registration link with others. Get them to register through this link. We also, beginning on February 4th, will have twice weekly office hours. There are up to 10 sessions that you are able to come and ask questions at. Those dates and registration links can be found on our website. You do have to scroll down a little bit, and then you'll see some information on when those office hours will be occurring. We also have a lot of additional resources. We have the DHCS CalAIM webpage, the Round 4 guidance document, those gap filling plans that Oliver was mentioning, our CPI webpage if you're interested in getting involved and participating in a collaborative. And we also have a Grants Connect FAQ. So one thing I do want to call out, this is a newer resource. It is a guide to help you set up a Grants Connect account if you have not already signed back into one, if you have been logged out for a while. But there is also some really helpful information in there about adding additional grant managers. As Shannon mentioned, it is really important that you have multiple points of contact on your application. Once the application window closes, you may or may not receive communication from PCG or DHCS through that portal asking for additional information, or having some clarifying questions. So we don't want, and there's fast turnaround times to get that information from you all. So we do want to make sure if someone is on vacation, someone has left the organization, that you do have an additional point of contact on that application. We really don't want to miss any of that outreach with you. And then this is a breakdown of all of those helpful links. So the guidance document, we do have a PDF version of the application. Please keep in mind this is a sample and was posted prior to the application open, so some questions may have been altered. The sample is not a complete copy of what is in the Grants Connect portal, so strongly recommend you use the PDF as a guide, maybe to share with some partners as you're brainstorming how to respond to some of the questions, but definitely make sure that you're also reviewing the actual application within the Grants Connect portal. That highly important funding request workbook. So that is the workbook that you all will utilize and upload with your application submission. It has a couple of tabs. Please familiarize yourself with it. And again, we will go through it at the next webinar. We also have some additional newer resources, as Oliver mentioned, some sample budgets. So those will kind of guide you in how detailed you should be filling these budget templates out for your project. We have a mixed ECM and Community Supports budget. We have a sample hub budget, which we have heard a lot from the field that you all would like as a resource. So there is one for organizations who are applying as a hub. And then there's also a sample day habilitation budget. So one of those community support services is a little bit different because it is, a home-based type of situation versus ECM, where you may be going out to members' homes and things like that. So there is a sample budget for that. And then, as I mentioned, that Grants Connect FAQ, which is very, very helpful if you are having any issues with the Grants Connect application portal itself. All of these resources are uploaded and available on the PATH CITED webpage. You will scroll all the way down to the references section, and there are links to all of these. But keep in mind, I believe only 6 or 9 references populate automatically. So you may have to scroll down and hit view more to get to some more of these resources. So as you are looking for them, if you can't find it, try that view more, and you can always reach out to our technical assistance inbox if you are having trouble locating resources. And that concludes our webinar today. As previously mentioned, we have some upcoming future engagements in office hours where it will be a question and answer type of period. We also have our technical assistance inbox that you can reach out to via phone or via email. Thank you all for attending, and that concludes our webinar at this time. Thank you, everybody.